my channel. In this video, we are going to learn about hearing disability. One who loses his hearing capacity after he has acquired speech is known as hard of hearing. Those who are born with less capacity of hearing are those who lost their hearing capacity in the childhood before acquiring the ability to speak are known as deaf. The mechanism is normal hearing, the common causes of hearing loss, management and treatment options for hearing loss, strategies to improve communication with adult with hearing loss. So, we learn these things in this video. Deafness is usually the result of inner ear or nerve damage. It may be caused by a congenital defect, injury, disease, certain medication, exposure to loud noise or age-related factors. The chief symptom of an inability to hear sound for some hearing may be possible with surgery or using hearing devices. Lip reading skill, written or printed text and sign language may helpful with the communication. So in this slide, we know deafness is usually the result of inner ear or nerve damage, first point. Then it may be caused by congenital defect, injury, disease, certain medication, exposure to the loud noise or the age factors. Next, hearing may be possible with surgery or uh, the children or the adult using hearing device. Common causes. Hearing loss can have causes due to underlying the disease. Example include too much ear wax, loud or prolonged noise exposure, aging, getting an object stuck in the ear or medication side effects. These are the very common causes of hearing impairment. So, too much of ear wax in the children ear is very dangerous to cause the disease. Then loud or prolonged noise exposure is the another important causes. Getting an object stuck in the ear is very dangerous to damage the inner part of the ear. Medication side effects. Characters of a hearing impaired. More response to vibration and touch than to speech and sound. More alertness to visual cues such as movement. Little or no babbling during infancy. Delayed speech, delayed language development. Almost use gestures rather than speaking. Frequent request to have things repeated. The children's are frequent request have two things repeated. Irrelevant answers to the discussion on hand. Below academic performance or low level of academic performance. Understand more when watching the speaker's face. That type of children mostly watching the speaker's face. Deviation in speech. These are the characteristic features of hearing impairments. There are four types of hearing loss. One is conductive, then second one is mixed, third one is sensorineural, fourth one is central hearing impairment. These are the four types of hearing loss. Again, conductive, mixed, sensorineural and central hearing impairment. Then these are the factors causing impairment. Exposure to loud noise, illness, it may be hereditary problem or naturally by aging process. Then take some medication, side effects, head injury. Prelingual deafness. Deafness that occurs prior to the age of 3. Before 3 years, the deafness is acquired is called prelingual deafness. Individuals of with this type do not become fluent in auditory language prior to the deafness. Postlingual deafness means hearing loss after auditory language has been acquired after 3 years. In this slide, two types of deafness. One is prelingual deafness, another one is postlingual deafness. Prelingual deafness means the individual of this type before 3 years. Postlingual deafness means hearing loss after 3 years. Deaf or hard of hearing students must be provided with all speech and other auditory information by an educational interpreter. A skilled interpreter in the classroom, however, is no guarantee that students with a hearing loss will receive and participate in an accurate communication. So treatment of hearing loss, it may be medical, surgical process, using hearing aids, assistive listening devices, cochlear implants, communication strategies. These are the treatment of hearing loss. Thank you. Thanks for watching. If you like this video, please share with your friends.